A bill could change how immigration enforcement operates inside of Oregon hospitals. Supporters with the Oregon Nurses Association say it's about patient safety and access to care, but critics say it could complicate hospital operations. A new bill headed to the Oregon legislature would limit how hospitals interact with federal immigration agents after a rise in tense and sometimes violent encounters in and around medical facilities.
Nurses are seeing and experiencing the same feelings as everyone: worry, uncertainty, grief.
Backed by the Oregon Nurses Association, the proposal comes as immigration raids under the Trump administration have expanded into Oregon. The association points to a series of troubling incidents: federal officers roaming hospital hallways, pressuring doctors to discharge patients early, and in one case, shooting 2 people outside of Adventist Hospital in Portland. Nurses say those encounters are making patients afraid to seek care and putting frontline staff in impossible positions.
No nurse, doctor, or paramedic should have to choose between following their ethical duty and navigating law enforcement activity in the middle of a medical crisis.
State laws can't regulate federal agents directly, but it can regulate hospitals. The bill, called the Healthcare Without Fear Act, would be modeled after a similar law in California. Supporters say it includes 4 main provisions. Hospitals would be required to clearly define public and private patient areas, restricting law enforcement access without a warrant. Immigration status and birthplace would be treated as protected health information. Healthcare workers would be protected from retaliation for providing patients with Know Your Rights materials. And hospitals would have to establish clear policies so administrators, not nurses, deal directly with immigration agents. The Oregon Health Authority would enforce the law with the power to suspend or revoke hospital licenses for violations. Some hospitals, including Legacy Emmanuel, dispute part of nurses' claims, arguing in a cease and desist sent to ONA that it is their actions discouraging patients from seeking care. But backers of the bill say the stakes are clear. Hospitals should be places of healing, not fear.
I became a nurse for the same reason many of my colleagues did: to care for all patients regardless of background, immigration status, or whether they're in detention.
The bill is expected to be introduced during the legislature's short session later this year.